All right, so the next thing we're going to do, I'm just going to skip over for just a moment. Now, here's what we've done so far. I know that was a lot, but I wanted to show you just the importance of knowing. For instance, you always hear me say that it's so important that you know the basics. It's so important that you know the fundamentals well. When you know the fundamentals well, you will figure out everything else a lot easier. If you don't know the fundamentals well, all right, so let me show you something. Let's say, let's say, here's your knowledge. Okay. Well, if this is what you know, it's going to be very difficult. Let's say your patient doesn't have one of these things that fits in this window. Maybe your patient has something, one of these outlying situations. If you don't even know to consider it, you're probably not going to consider it. Therefore, it's going to be less likely that you're going to treat it properly. So it's so important that you have a really wide degree of knowledge, especially in the fundamentals. What it allows you to do is it allows you to have a really big differential. And when you have a big differential, you can consider a lot of things. And of course, you can rule those things in or out and eventually come up with, okay, it's likely this or this, and kind of go from there. A good history, a good physical exam, using labs and labs and imaging and so forth, and hopefully come up with a really good diagnosis and be accurate. So let's just clear that off for a moment. Now, so far, remember we started day one, we did the 10-question quiz, and I asked you some questions just to kind of get your juices flowing. Then we went over the chambers of the heart, the valves, the blood flow, the vessels. I'm just speeding through this just to tell you how much we've covered already. We went heavy on the electrolytes. Remember, I told you I broke down the P wave, the PR segment, the PR interval, the Q, the R, the S of the QRS. I broke down the ST segment, the T wave, the U wave. I told you what's happening in each one of those. I told you what phase is it? Is it going to be phase 0? Is it phase 3? Is it phase 4? For instance, in the AV node and the ventricles, there's also phase 1 and 2. Go back to that if you need some help with that. I think that was on day 2. We talked about the electrolytes that are responsible at every phase of the EKG. So, for instance, if there's a P wave problem, we know that's dealing with atria. Well, that's more than likely a calcium issue. However, if it's something in the QRS, that's a ventricular issue. If it's an electrolyte abnormality, it's more than likely sodium. Okay. We talked about, for instance, we went heavy into the membranes and the negative, how the membrane is very negative. And I told you about the phospholipids and why it has that negative charge. We talked about depolarization, the rush of positive electrolytes going to the inside of the cell. So the inside of the cell becoming more positive. That's what we mean by depolarization. When the inside of the cell becomes more negative, that's repolarization, okay? We talked about hyperpolarization, all the different waves, intervals, segments. Remember what electrolyte is responsible for contraction, whether we're talking atrial contraction or ventricular contraction, that's always going to be due to calcium, okay? We talked about the different phases, phase 0, 3, or 4. If we're talking the SA node, or 0, 1, 2, 3, 4, when we're talking the AV node and the ventricles. Now, let's see. All right. So the next thing I want to show you something. I'm going to talk about this in the bonus round, but here's what I want to do for a moment. Actually, let me back up for a second. I want to show you something. Okay, and I'm going to talk about this later in the bonus round, but for those of you who don't see it. So when it comes to, most of you know, okay, a patient presents and you're looking at a whole human, right? But we never are treating things based on the whole human, the whole organism. But we know that this organism is comprised of, for instance, all these organ systems. And these organ systems are obviously made up of individual organs, right? But these organs we know are made up of tissues, for instance, okay? Whether we're talking nerves or muscles or blood or bone marrow. So those are all tissues, okay? What's really important is to know things, for instance, down to the cellular level. When you know the cell well, you will know more about everything. Trust me on this. Now, I remember in medical school, in those like first semester, probably first semester or second semester of medical school, it was heavy on the cell bio, heavy on biochem. See, I didn't think I needed to know. I'm like, yeah. I mean, nobody needs to know that kind of stuff about organelles and the cytoplasm and the nucleus and all of that. Like, why do I care about that? Well, see, the thing is, in school, in nursing school, in medical school, paramedic school, people tell you that kind of stuff, but they don't tell you why you need to know or why you even need to care. It was later when I met my mentor, he told me why I need to care and why I really need to understand what normally happens. It's very difficult to figure out abnormal if you don't know normal. Let me say that again. It's very difficult to figure out abnormal when you don't first know normal, okay? So it's so important that we understand the cell. And you're going to see in the bonus round today, I'm going to show you, I'm going to use some examples. We're going to go all in that cell, baby. We're going to be so deep into the cell, and you're going to see how, if you understand the cell, you will know more about everything. I promise you, you're going to know way more than your colleagues. You're going to know more than most clinicians just if you understand the basics. And I'll prove that to you today. I want you to understand the cell. For instance, I want you to understand things at the elemental level or the atomic level. I want you to understand organelles. I want you to understand molecules. All of this is real basic stuff, right? None of it's real sexy. None of it's glamorous. But this is how everything else works. The micro works at the cellular level. The immunology, there again, is the cellular level. The biochemistry, the physiology, all of this is down here at this level. Now, here's what I want to show you. Here's an example for a moment. So, for instance, all I have here is some real basic words. I just have basic stuff written down. So, for instance, I have various cell types: red blood cells, white blood cells, platelets, stem cells, endothelial cells, and so forth, right? If you know, for instance, a red blood cell, if you really understand red blood cells, for instance, how are they made? How do you make a red blood cell? What are the components needed? What's the life cycle of a red blood cell? If I know that information, well, now just by me, follow me here for a moment. Everybody with me? Just look at me for a moment. Let's say I take something as basic as just a red blood cell. But if I understand how do I make the red blood cell? Well, I'm going to need, for instance, heme. I'm going to need iron. Well, I'm going to need iron first to make heme. I'm going to need heme to make hemoglobin, right? If any of that messes up, I can't make hemoglobin. Now I'm interfering with oxygen carrying capacity, right? So now I can tie in, for instance, the oxygen dissociation curve and right shifts and left shifts. We can go from that just by me knowing the red blood cell. Well, now I can tie in, for instance, what if I have too many red blood cells? Now we're talking about things like polycythemia, right? What if I don't have enough red blood cells? Well, now we're getting into things like anemia. So literally from that, here, let me just draw this out for a second. This is cool stuff. Watch this. Watch what I'm going to do here. All I did is I said, hey, this is why you want to know the basics. Let's say we got a red blood cell. But in order to know a red blood cell, so this is just basic stuff, right? But let's say in order to make a red blood cell, for instance, I needed hemoglobin. But in order to make hemoglobin, I need heme and globin. In order to make heme, I need iron. Okay? So if I have a problem with any of these steps, there again, that's going to interfere with quality red blood cells. That's going to interfere, of course, with oxygenation. If I have too much, now we're getting into things like polycythemia. If I don't have enough, I get into things like anemia. Well, let's say if I'm in anemia, well, I can divide anemia, for instance, based on the MCV, based on the mean corpuscular volume, I can divide that into, let's say, microcytic anemia, let's say normocytic anemia, let's say macrocytic anemia. Okay? Now, how did I get here so quickly? Just by knowing the basics. So for instance, now that we're in microcytic anemia, well, shoot, we can talk about iron deficiency anemia, anemia of chronic disease, cerebrovascular, thalassemia, right? We can just go. we can talk about things like sickle cell. Of course, we can talk about all the different mutations involved with sickle cell. Okay, when I'm talking, and there's so many here, but just for the sake of time, When I'm talking about macrocytic, okay, now I can be talking about things like B12 deficiency and pernicious anemia, and we can tie in things like intrinsic factor. We can go into, let's say, a folate deficiency. So we have a B9 deficiency that could cause a macrocytic anemia. Now, but what did I do here, guys? All I did is I took a basic concept and I just kept going and going and going based on the next word that came to my mind. How is it that I'm able to do this so well? It's because I have the information very neatly organized in my brain. See, the reason that most of you have trouble figuring out what's wrong with your patient is you just don't know enough. Does that sound rough? Okay. It's simply that you just don't know enough. Or you're just trying to memorize, okay, what did I read about 5 years ago on page 439 in the bottom left corner highlighted in green? Well, that's a really lousy way to be able to recall the information. But when you know the information, when you truly understand it by mastering the basics, you'll be able to figure out so much very, very quickly. Watch what I do later in the bonus round today. I'm going to keep going, but I just wanted to show you why you want to know more about the basics, okay? Now, let me go back to this. Look here. So here I just have the word hormones. Now, how well do you know, for instance, let's say antidiuretic hormone or follicle stimulating hormone, luteinizing hormone? How well do you know things about just hormones? In the Level Up Medicl Mastermind, I will go heavy into the endocrine and I'll explain literally every one of these. But guys, I could spend like 3 days on just this one slide. But here's what I want you to see. Remember how earlier when we were talking about blood pressure, and I said that heart rate could be affected by hormones. Well, this is just a partial list, but look at all the different hormones you probably should kind of consider or at least think about before you're just trying to manage somebody's blood pressure. Okay. Like how would insulin or glucagon or aldosterone or estrogen, testosterone, DHT, how would they affect, for instance, blood pressure? They absolutely could. Okay. Of course, neurotransmitters can affect blood pressure. See, all of this stuff is really basic, but if you don't know the basics, you don't think about, there's so much that you're going to miss when you don't really know the basics. Okay. Now I'm going to move on from that just in the interest of time. Now let me go back to where I was. All right. So hold on just a moment. We've covered a lot, guys. All right. Here's the other thing I wanted to go over.